So now we know from our experience that we had with COVID 19 that vaccination itself is not an easy discussion. The issue of vaccination was very controversial. People were resisting vaccination a lot, and for their own reasons, religious reasons, and the fact that there were so many conspiracy theories and well, people didn't understand what was going on as far as COVID 19 is concerned, to the extent that it became mandatory. But what we see is what we also saw is people just encouraging other people, like presidents. We've got the president of South Africa, Mr. Cyril Ramaphosa. He was encouraging the citizens.
Tonight, I'd like to call on every person who has not been vaccinated to go to their nearest vaccination station without delay. If there is someone in your family or among your friends who is not vaccinated, I call on you to encourage them
to be vaccinated. And we also have input from Tanzania, and Tanzania's story is actually interesting. The president there, Magufuli, he didn't believe in vaccination. He actually said people are going abroad to get vaccinations, but they are leaving our traditional herbs that we have got here. And it was only a matter of time before he died of a heart condition, but it is suspected that it was COVID 19. So nobody really knows what went down there. But the point is that it was a controversial issue.
Tanzanian. There are some Tanzanians who recently traveled abroad in search of the coronavirus vaccine. These people brought the virus into our country when they returned. Let us stand firm. This vaccine is not good at all.
Some instances of disinformation of some sort. President Biden of the United States, when he actually said, look, when you are vaccinated, you are now safe. You will not contract COVID 19 at all. That's what he said. And yeah, it's all sorts of things that were taking place there.
Okay, you're not going to get COVID if you have these vaccinations.
Now we need to look at the work by Howard and how that is connected to all these controversies. So, based on what these events that you have seen, presidents calling for people to get vaccinated, some denying, some giving some misinformation a bit. But then those are some of those things that you are going to find that they were justified here by Howard when he said the existence of a herd immunity threshold is also far from obvious. Because if it was obvious, then it was not going to be a problem. People were not going to say, look, if you're vaccinated, then you won't get the disease. If you are this and that. So even to the extent of denying. So the others were denying the type of vaccination that is needed, but it was a critical point. So what you find is that a significant number of experts thought that such a threshold did not exist and thus believed that mass vaccination programs were bound to fail. The reason it was missed is that it cannot be discerned from the data. Even though we have got the data, but that is not enough to tell us about this herd immunity threshold. It requires again a mathematical model to illuminate. So what is taking place here? What is taking place here is the need for us to have an RE that is less than or equal to 1. That's what we need. And we've already established that, look, our RE is going to be equal to this guy that we've got there, and we require it to be less than or equal to 1. So in order for that to happen, we are going to make sure that it happens if and only if we have got a critical vaccination threshold. That's what we need, a critical vaccination threshold. It means that the number of people that are vaccinated are either equal to that critical vaccination threshold or even greater. So say we need to have for herd immunity to be effective, because you've got so many people like this, right? But then, do you think that the virus is going to die away if only these two get vaccinated? Definitely not. So we need an ROC, a critical threshold of vaccination, to say, look, at least by minimum, if this much number of people is vaccinated, then we are going to have a situation whereby we get herd immunity. So that is one of the things that we need to master here. Let's look at this from a perspective of an example and see how we are going to go about this and see if that can actually help. So what then is required is that rho is greater than or equal to rho C. So what we need here is a rho C. And if then you play around with the formula, you are going to get this result that we get there. So here is an example that was given by Howard. Assuming a completely susceptible population, to mean that everybody in that population is susceptible, can get the disease, to prevent a flu outbreak with R0 is equals to 1.3, one must vaccinate only 23% of the population to prevent an epidemic. If the vaccine is only 60% effective, then it is easy to verify, and we must do it, right? That one must vaccinate at least 23% divided by 0.6, which is approximately equal to 39% of the population. So again, we are using our formula that we have got here to find the least number of people that you must vaccinate. All right. So we know that we have got 1.3 here for that guy. So 1 minus 1 over 1.3, and that must give you that result that we have got there. You must try it on your own and see if you are going to get that same answer. But at least now you must appreciate also that what happens is that so here, if you do the math, this will be 1 minus 0.769, and that is going to give you 0.2307. So that is the 23% that we're talking about. All right. So what we are simply saying is that now we have also to look at the vaccine and its effectiveness, to say if the vaccine is only 60% effective, then you need to say, look, 23% divided by 0.6, and then you get 39% of the population must be vaccinated. To prevent a smallpox epidemic with R0 is equals to 5, can you see now that we've moved from RE to R0? One must vaccinate 80% of the population. All right. So again, like we said, it's 1 minus 1 over 5. 1 minus 1 over 5, which is equals to 1 minus 0.2, which is equals to 0.8. And based in part on this finding, along with the belief that humans are the only natural hosts. So this is an assumption that we are making now to say, look, for chicken pox, for smallpox virus, it is only found in humans. So we are not worried about wild animals or other animals. In 1967, the World Health Organization actually mounted a successful worldwide smallpox eradication program. So smallpox is one of only a very small number of human infections that have been almost completely irradiated around the world. Even if a malaria vaccine that is 100% effective can be found, since R0 is greater than 100, it would be necessary to vaccinate 99% of the population to prevent epidemics. Can you see that there is a lot of work across the world and in Africa especially to eliminate some of these epidemics, the malaria, cholera, and tuberculosis, etc. All right.